through already, no, with the skin changes, no? Manaman ta sa skin changes. So remember that we has skin changes class, no? So one is the striae gravidarum, or the presence of stretch marks, okay? The linea nigra, and the third one is melasma or cloasma class, no? So again, ang kanimong linea nigra class, mag-uol sa ni sila, no? Ang question na nila, ma'am, kanang awa pa ni siya, ma'am, no? So is this a permanent mark or not permanent, no? So linea nigra will also fade class, no? Shortly after the woman's give birth, mawala na siya, but not instantly na ikaw sa bata, mawa sa nga to ang linea nigra. Nagyapon na siya. So that will take time, no, to fade class, no, or to disappear siya, no, within the 6 weeks niya. No, not 6 weeks, rather. 6 months di ay, no, nga changes in her body, no, after she gave birth, no. Kana bang mubalik na sa iyahang from pregnant state to pregnant state sa iyang condition of her body. So that this also includes the linea nigra class. So 6 months, no, at the time of involution class, no, involution, no? That's the process, no, being here iyahang uterus, balik sa iyahang pregnant state, even the form of her breast, and so on. So there are also many changes in the body that will take place after she delivered her baby. So apila sa diri ang ato ang linya nigra. So mawaa na siya class. Ang dili mawaan ni class that becomes permanent class is unsa man, the striae gravidarum or the striae gravidarum or stretch marks. So that's a permanent, no, skin, a change there, no, the skin change that becomes permanent already. So di na siya mawala. Naagyon na ang imuhang size good. Okay? So let's now move, no, to another presumptive sign, fatigue. This is the last, no, presumptive sign, no, the 8th sign na to, fatigue. Is a presumptive sign because this may also be related to anemia. So gatuot ang magdos pero dili di ay magdos. Kay basin siguro ang iyang fatigue, no, there is a feeling of tiredness, mga really tired kayo tanan, is because of anemia, no, or it may also be related to other disease condition. So fatigue is a common complaint by most patients na to during the first trimester. So meaning to say, noticeable kayo siya early part of pregnancy, no, or early pregnancy. This sign of kanang kuan class, no, pregnancy happens, no, this sign of pregnancy, this fatigue sign happens because of high levels of progesterone class, no. So this fatigue class symptom, similar to other early pregnancy symptoms, this fatigue also tends to subside or to get better in the second trimester. Pero sad, no, after week 13 class of pregnancy, no, okay, kana siya, mawa siya diha, no, ika-second trimester after 13th week, pero mobalik sa siya class, no, in the third trimester for many, no, of our pregnant women. So it does come back siya in the latter part of pregnancy, no, the last trimester. So sa ato pa, abtik imo mama in the second trimester. Sa ato pa, gikan sa iyang feeling nauseated or if not katong gasuka-suka gyud, no, so to some women nato in the second trimester wala na ang suka, gana na sad kaayo mukaon ang imuhang mama, abtik pa mong mama, kusog pa kaayo mo kaon, diba? So kalabanan yun ang discomforts of pregnancy, although second na agyapon sa second trimester, but a few of them, no, can be experienced here or can be felt na in the second trimester. Kalabanan yun ang pinaka-hassle in the early and also in the latter part, no, or the last trimester, no, of the woman's pregnancy. So those are the presumptive, okay, signs and symptoms of pregnancy class. So mao to siya presumptive signs and symptoms of pregnancy. Those 8 signs na to. 8 man to sila kabuok class. So sa ato pa 8 ng atong memorization. No? So to kuan siya class, to help us with this presumptive signs and symptoms class, we will use this mnemonic presume class to help us remember, no, the presumptive signs. Okay? Unsa man ning mga presumptive signs nga naa sa mnemonic presume nato, okay? So P for a period that is missing, no, or amenorrhea, dili ba? Absence, no, of menstruation, no? Period, that is absent. R for really tired body, and that is fatigue. E for enlarged breast. S for sore breast, no? And another presumptive sign that also relates to letter S, no, in mnemonic crucium is skin changes. That includes the striae gravidarum, linea nigra, and melasma or cloasma. U is urination, that is increased, no? Or there is urinary frequency, ha? So, murag gibusaw, no? This is a presumptive sign. Another presumptive sign is movement of fetus in uterus as perceived or reported or noted by the woman. Presumptive sign. And another presumptive sign, okay, that can be associated to letter M in mnemonic crucium is the mild smelling vaginal discharge or leukorrhea. And E for emesis and nausea or the morning sickness. Okay, so let's now move to the second classification of pregnancy na to, the signs and symptoms of pregnancy, the probable signs of pregnancy. So, unsa man yung probable signs and symptoms of pregnancy, no? So, unsa man yung probable, ma'am, no? So, kaning kuan na to, probable signs of pregnancy, these are pregnancy signs class that the nurse and the doctor can observe and document. So, meaning to say, they are all objective, no? The signs here are all objective. Kana mismo, kita as an examiner, makita na nato, no? It is by visual examination. The inspection is by visual siya and also by palpation, no? Ato sa siyang ma-feel, mahikat nato siya. However, though these are objective signs, no? These signs do not mean 100% that a baby is growing inside class, that there is really a fetus there. Because it can be due to other causes, no? So, wala pa gyapon tay kasigaruhan, but this is much better compared to the first classification. Because probable means very likely to be true. Katong presumptive, siya raman to, nakanote. Wa man ta kakita ato, wa sa nato siya matan-aw, malili, no? Di malili siya, di nato makita iyang sintomas, di nato ma-record, di nato ma-document, di nato ma-inspect, di nato ma-examine, no? By palpation. Okay? Pero ang probable, nahimo siyang objective because we, no? As health practitioner here, we can actually inspect it, no? We can palpate it. Makita na to. Pero, these signs mean not yet a 100% na positive signs of pregnancy. Wala. Because that can be due to other causes. Diba? So, probable means very likely to be true siya. So, probable sa Bisaya, lagmit, no? Dool-dool, no? Lagmit is dool-dool na. Diba? Oo, so dool-dool na ta. Pero dili pa gyud na mao. Wa pa gyud, di pa gyud siya absolute pa. Pero lagmit lang, no? Lagmit. So, let's take a look at here, class, no? The probable signs of pregnancy, okay? So, the changes that happen in the uterus, class, no? Unsa man yung mga changes na mahitabo niya, no? Karon kung kay objective man siya, nakita gini nato. So naikausaban sa iyahang uterus niya. Nitubo ang iyang uterus. The uterus undergoes changes, class, its position and size, no? So ang iyang pagtubo, ang iyang pagkalapad niya, no? This expansion, class, no, will make a room here, no, will provide siya a space, no, a room for the fetus. Okay? Muna siyang nilako siya, nilapad siya. Pero, dili man siya positive. Okay? Probable naman siya. Kay dili ang tanang na nidako og tiyan, class, mabdos. Diba? Okay? Dili tanan sa kalinguno sa iyang pagkadako sa iyang tiyan, bata ang naa sa sulod. It may be because what is inside siya is an increased growth here, no, of a mass, no, or if not, a tumor. Okay? Right? Good anang mayoma. Kung ang babae na ay mayoma, murag sa mabdos tan-aw. No? Mura sa siya na ay baby bumps, no? Na kumutupo man gali ni activated ka iyahang mayoma, sumura ra din siya mabdos nga iyang gitubuon ani niya ang growth niya sama ra sa babae nga mamabdos na hanto sad ko diri sa xiphoid process or near to the xiphoid process or passing the umbilical level, di ba? Oo. So, ano siya, gitawag siya og probable. So, one of the most recognized changes in a pregnant woman's body class is, of course, the appearance of the baby bumps na to. Diba? The uterus rises above the symphysis pubis by the third month of her pregnancy or 12 week of pregnancy. And then as pregnancy continues, now karon, ang uterus is, of course, will leave the pelvis and it will ascend, no? It goes up no, to the abdominal cavity, reaching, of course, the xiphoid process by the 36 weeks of pregnancy. Diba? Hinumduman gid mo ana, no? So magbalik-balik na gyud ta aning dapita, no? Now what about the size niya? Of course, no? There is an increase, no? Size here, the growth, no, of the uterus class, no? The uterus increases in its size, no? Its weight niya from 50 to 1,000 grams niya. 5 times, no? Its normal size, no? So klaro ka isa natin, makita naman nato, di ba? So katong pang pagprimero nga babae pa, no, nga mabdos gud siya nga gatago-tago, siya na gyud nakaibaw nga mabdos siya. Kay ang iyang presumptive kato mao to di pa nato makita to. Kasi ra may nahibaw. Pero kung ang tiyan na gali nga ni dako na, dili na. Probable na siya. Nga ang tao makakita nga nitubo iyang tiyan nga ni dako la. Mingon sad ang tao nga nakakita na ani nga simptomas, no, other than her. Okay? Sa presumptive siya raman. So, other than her, sa probable, makaingon na tala. Di ba kani siya mabdus? Hindi ko man yan tiyan. Diba? Can you relate me, class? Can you connect me? Are you following me, section G?
Yes.
Yes. Adi na ko wala na. So, another change in the uterus class is the Hagar sign na to, no? So, what happened to the lower uterine segment? So, the lower uterine segment class becomes so soft already. So, Hagar sign class is the softening of the lower uterine cervix, okay? Let's be very specific. This is the isthmus part of the uterus, no? This is the area between the cervix and the body of the corpus, no? Namuhumok na siya, class, no? Now, during the bimanual examination, as shown here in the illustration in this picture, class, no? That the dominant hand of the examiner, no? The fingers, no, of her dominant hand, yet 2 fingers here are inserted into the woman's vagina. And the other hand is, of course, on top of the woman's abdomen. No? So, when the uterine segment here is compressed, class, no? Okay, upon inserting the fingers there, the fingers will press yan, no? Okay, touch, no? That area and press. And then there is also a movement here or a press, no? Kanang movement, no? Okay. Sa imuhang non-dominant hand, no? So, causing, no, that will cause here the uterus to tilt forward. Kita mo? Kanang yung pag-tilt forward, nga hapit na may abot ang iyahang anterior fornix na of her fingers here. And then also, the other fingers in her non-dominant hand, nagpasabot na siya, class, nga humok kaayo na ang lower uterine segment. Okay? So the wall here, the softness here, the wall feels tissue paper thin. No? So yung anak kanipis, yung anak kahumok siya, nga igkap-kap anak, may inspection nga, mapalpate siya, mahikap siya, humok siya, and then hagariyot nga mag-abot na iyang kamot, yung anak na siya ka nipsa. And that is your Hagar's sign, class. Ha? So muna siya yung Hagar's sign, class. The wall feels tissue paper thin here. So remember, Hagar's signs that occurs here at 6 to 8 weeks of pregnancy. Okay? So, okay ra? So the next nato is balutment. So this is also another change that take place here in the uterus. Unsa man ning balutment, ma'am? So kaning balutment, class, this is demonstrated during the bimanual examination. Okay? So done at the 16th to 20th week of pregnancy. So, balutment, class, no? Bimanual. O sige, gibuhat ani. So, ang gibuhat ani, class, no? The fingertip here, no? One hand is inserted in the woman's vagina, and that hand is in place there. The tip here pushes, no? Or taps, no? The lower, part of the uterus. Push ana niya class, what happened to the fetus here? Of course, the fetus will move upward siya or floats upward, no? And then sink down na sad siya or it will descend or goes down, no? It will go down as it siya no goes back to its position niya. Or it gives here a bouncing, no? Effect niya or impact, no? A rebound, no? Or bouncing back, no? Impact here of the fetus. So meaning to say, kanidi nga nung ni-move up siya and then ibalik siya is because of the fluid that is present here. So, possibly, no? Probable signs siya of pregnancy. Nga ma-feels niya sa examiner sa tip nga, there is a rebound, no? Of an unengaged fetus. This is unengaged fetus. A probable indicator of pregnancy class na nga posible mabdus ni siya. Okay? Probable siya kay because class. This is not considered diagnostic, no, of pregnancy dili man. Kay nganong dili man siya, no? Nahug lang siya probable kay because the kanibang the rebounding niya nga effect niya, no? Or the bouncing back niya or the returning, no? Effect ani niya can also be demonstrated or elicited in the presence of ascites. Okay? So, kabaw man siguro mo unsa ng ascites, no? So, there is an excess accumulation of fluid in the liver organ niya, no? Or in the abdomen itself, no? Causing also the organs in that area said to bounce back if you are going to do the bimanual examination. So, magtuot nga mabdus pero dili di ay, no? Kay it may be related to other condition. Or if not, ovarian cyst class. Okay? Because an ovarian cyst side, outward and outside of it siya, no? Is fluid sad siya, no? Na, which is very similar also, no? Kung bata siya nasa, which is very similar kung naibata sa sulod. Pero, dili siya di ay, no? Probable siya, kaya pwede man sad siya, na dili di bata, but ovarian cyst. Do you get me? So, another probable sign is the change that happens in the cervix class, no? So, what happens now to the cervix? The cervix, normally, in its consistency niya class, kung hikapon ang ato ang cervix class, it is firm na siya to touch class. Like the cartilage, no, at the end of our nose. In ana, ka-firm ang iyong cervix. Hikapan na iyong cartilage here, no, at the end of our nose here. Kani, ing ana ka-firm ang cervix ni for a non-pregnant state na to or pre-pregnant state na cervix, no? Dili mabdus. Pero kung mabdus na gali, kap ana cervix, humok na kayo na siya. And that is what we call Goodell sign. No? So Goodell sign is when there is marked softening, no, of the cervix class. And this is present 6 to 8 weeks of pregnancy. Same also with Hagar sign. No? Yung 6 to 8 weeks siya. Ang balutment, the bimanual examination here to test, no, balutment class. Balutment is demonstrated at 16 to 20th week. Goodell signs, 6 to 8 weeks class. No? So, the positive Goodell sign class or a positive, no, Goodell sign occurs here due to increased, no, blood flow. Okay? Notice in the cervix itself niya. Okay? So, kanang pagkahumuko niya, it is because of increased vascularity under the influence of what hormone class? Estrogen. Okay? So, kanina dapita, that gives there, the vaginal part, no, of the cervix, a bluish appearance. No? Siyang pagkahumok niya, iyang pagka-increase vascularity in the area, okay, it will give the vaginal part of the cervix to appear blue in its color niya class. And that is what we call Chadwick's sign. Okay? So, mana yung timan no? So, ang Chadwick's sign class, due to increased vascularity, the cervix here become bluish or violet color. This is the normal color. It is a light pink na siya nga color. Pero kung mabdus siya, Chadwick's here, okay, the color is blue or violet. Okay, so that is your Chadwick sign. So another probable kining sign class no, that happens in the cervical structure no, of the woman's reproclass is the formation of a mucus plug, okay, or operculum. Okay, ihang operculum, no, or the formation of mucus plug. So operculum class, the other name of operculum is show. SHOW. Okay? So naana siya purpose class ang operculum, no? So that plug there, that mucus plug that forms in the cervix class, okay? This mucus plug here, the formation here, no? Or the plug here is from actually from secretion siya, no, of the cervical glands, what else, okay? O cervical glands siya, kaya siya sa cervix, no? So, this mucus plug, by appearance niya, it is clear siya, take gihapon siya, no? Pero ang iyang consistency is gelatinous, no? So, this thick jelly-like mucus class is called operculum or show, no? So, it has a purpose class, no? The purpose of this operculum, kay this is a non-pregnant, no? Cervix na to, wa man na. Pero igmabdo sa babae ani, naani ang imuhang mucus plug. And it serves a purpose here because it protects our baby. Why? Because it seals the cervix here of the pregnant uterus, no? Okay, not to allow no the bacteria no to enter or to gain entrance into the uterus. So mao na iyang purpose, no? So mo seal off na siya for a moment, class, no? To protect our fetus, our baby from contamination by bacteria in the vagina. No, kita mo sa image diha, no? So ingana siya class, no? It remains to be there, no? Pero this will be expelled out siya. Kay kaniyang pagkabaga niya class sa iyang mucus plug, aduna na siya purpose class, no? So ang iyang pagkapilit niya, naa na siya purpose, no? So nga pilit na siya, nganong baga na siya, kay tungod na ana siya mga antibodies that can protect the growing fetus, no? From any bacteria, viruses, or other disease-causing agent class. So it therefore prevents here premature labor because one major cause na to, or very common said na cause of premature labor is infection man, diba? So, nanong naana siya class, no? It is because of hormone again. Primarily, is it the estrogen or progesterone? May nga pagkabaga, gali, kung sa itong makapabaga, no? It is the progesterone side, no? So the progesterone causes here the thickening, no, of this mucus in early pregnancy. Pero sad class, igdool na sa panahon nga mga anak na ato ang babae class, no? This mucus plug becomes thin also, okay? In the presence here or under the influence of estrogen, no? In late pregnancy, munipis na siya class, no? Ang ato ang mucus plug or the operculum, okay? Nganong munipis man siya? Okay, because the cervix also becomes so soft already that the cervix will now start to open, no? To dilate. Para mag-labor na ang babae. I-dilate na niya, munipis na ni siya class, no? Ani siyang part diri o dinhi mo, abot na siya na. Muabli na siya, of course, that will expel out the mucus plug. So, matangtang na siya. Iglaksit na niya, there is a blood, of course, no? As that, kuan siya, that, the thing there will separate, no? Or makes a separation, no? In the cervical lining. So, mo bitaw ng a bloody show is a sign of labor na siya. Preliminary sign na siya sa labor. Nga kanang ihang nangutana gali ta, hala, naamang ko'y mga pangagian na, no? Kay ningon na ba to ba sa ingani ang color sa pangagian, ingani ang iyang appearance na mura siya white blood, but there is a blood, a white, tinge siya, no? Sa white blood, no? Murag sip-on, pero naagyod to ang siya, baga na siya, pero naa siya dugo, o mo na siya gitawag og bloody show. That's the operculum class, na? Na it already kanang separates na from the cervical lining, no? So manang paano na siya, sign na siya nagmatuod na that any time soon the woman here will have labor na yun. Okay? So, timan ina ninyo, ha? So another probable sign class is kuan kaning Braxton Hicks contraction. The Braxton Hicks contraction class are false contractions. Okay, painless, ordinary, painless uterine contractions occurring throughout pregnancy, but the contractions here appear to be irregular. Dili siya regular class. Painless, irregular, no? That will never cause here cervical dilation class, no? So bisan tuod na siya na siya tightening, no, nga feeling nga hugot-hugot iyahang tiya niya kay ga-contract siya, pero there is no a relief here no of this contraction by walking or any other form of exercises sa babay. So mawala na siya. Because a true contraction class, no, kung tinuod nga contraction class, it is painful. There is pain. Through contractions also, the pain sad, the intensity also heightened. Through contractions class, no, whether the woman is walking or whatever the woman's activity class, these two contractions will never fade siya class, no? Magbalik-balik na siya at regular na time period. Mudumdum na siya. And true contractions class can cause the cervix to dilate. So, mo na siya difference sa Braxton Hicks nimo o true contractions class. Okay, tinadi ha? So, that's your Braxton Hicks contraction. Okay? So, that usually begins at about 12 weeks no, of pregnancy and becomes progressively stronger siya no, as the pregnancy also continues or progresses, by which are often called false labor siya. So, ano siya after 6 months no, or 28 no, weeks of pregnancy niya. Okay, so please na you will know already the difference between the Braxton Hicks and true contraction. So another probable sign class is positive pregnancy test here, okay, by the physician. So ma'am, positive pregnancy test is probable sign. Dili lagi na siya positive. Kuan ma'am no, pregnancy sign. So ang positive pregnancy test na to is probable. It belongs under the second classification. This does not belong in the third classification. Basig ma-misled na mo kay. Ningon na bag positive pregnancy test, yun dahil answer positive na siya nga pregnancy kanang classification of signs and symptoms. No, probable na siya. Nganong probable man ni siya class, no? Because sa pregnancy test na to, if you could still remember, the test here in pregnancy are based on the analysis of the maternal blood or the serum, no? Or urine nato for the detection of what? HCG. Hinom naman siguro mo, diba? Human chorionic gonadotropin. Mabita na sa pregnancy test, sabutan niya, human chorionic gonadotropin or HCG. So pregnancy tests all depend on the detection of HCG either in urine or blood class, no? So this may be misread ni siya class, no? Kung ato siyang matanaw siya, no, nga positive signs siya of pregnancy. Dili. Okay, because even if the test here is positive, it could also be related to other condition. It may be the result okay, is related to ectopic pregnancy, or if not, it may also be related to high TD4 mole or H mole. Diba? Katubang abnormal growth of the first ovum or the zygote ba class ba, no? Katong uray atong giingon ninyo. Kay HCG man na siya, elevated HCG. Katuo siya nga mabdos pero dili di ay, no? So that's why the positive pregnancy test na to, okay, is a probable classification ni siya class. It is not a positive sign of pregnancy. Do you follow me? So the next probable class, sign class is the fetal outline palpation. So this is a probable sign in early pregnancy. The physician can palpate the abdomen and identify the fetal parts here. But this is not always accurate. Kaya pa man niya klaro sa siyahang palpation kung ulo ba na sa bata, siko ba na sa bata, the fetal back ba na sa bata, buttocks ba na sa bata, no? Tuhod ba na sa bata, no? Okay, so dili man or even the lower limbs, di man siya. It's not a guarantee after all that it is a fetus inside because kung mas sad siya or tumor sad siya, natural, no? There is also an outline that appears there. Nga mura sad siya mabdos tan-aon kay lingin man sad ang tumor. Ang kuan sad ang mass is lingin man sad siya, di ba? Oo, sumura siya mabdos tan-aon. So that is why a fetal outline palpation class, no? Or the uterine enlargement said nato, or fetal palpation here is a probable sign in early pregnancy. Do you follow me? So it is not always accurate. So what are the probable signs? So let's have this memory aid to help us recall the probable signs and symptoms of pregnancy. So remember the word probable, class. Use mnemonic probable for probable signs and symptoms of pregnancy, where P there is a positive pregnancy test, a probable sign. Returning of the fetus, no, or ballotment is a probable sign. Outline of the fetus can be palpated is a probable sign. Braxton Hicks contraction is a probable sign. The Google sign, a softening of the cervix, is a probable sign. The bluish color to the vulva, cervix, and vagina, and this is what we call Chadwick's sign, is a probable sign. Lower uterine segment that becomes soft, this is Hagar's sign, is a probable sign. Enlarged uterus is a probable sign. Okay? So remember, mnemonic probable, class. Remember, each of those 7, eight day, hapon, no, nga, signs and symptoms of pregnancy, the probable signs and symptoms of pregnancy. So let's move here quickly to the positive signs of pregnancy. Bubo na siya. Okay? Okay. Ila naman imong mahinumduman, 5 man ni sila. In fact, gusto pati siya, no, for positive signs and symptoms. So what do you mean by positive signs of pregnancy? Positive means conclusive na. The word positive, absolute na. Definite na yun na siya. So these are the positive signs of pregnancy, no, that are completely objective siya, class. It cannot be misled or confused with pathological state. So there is no other cause here other than the presence of the fetus. Okay? See, it gives us already a conclusive proof here of pregnancy because, okay, all of the signs and symptoms deal here with fetus, are attributed, recognized to a fetus. So there is no other cause. Woman, no, is undeniably here pregnant. Definitely, she is pregnant. Okay? Fetus naman siya, class. And the baby here, or the fetus being the evidence itself, class, is maklaro naman because you can hear the fetal heart sound. You can actually see the fetus through ultrasound scanning. Makita na nimo diha, even in the early pregnancy, what you see there is the presence of gestational sac. And gestational sac, or the embryo sac siya, is of course a product of pregnancy because that will develop later into fetus, no? Klaro na kaayo. Or even siguro in later pregnancy, middle to later siya, klaro na din mo dihang makita is ang bata. The baby is moving there through ultrasound, no? And then, the fetal parts can also be palpated through the abdominal wall, no? So that fetal parts include the head, the fetal back, okay, the elbows, no, the upper and the lower limbs, no, and other parts niya, no, nga sa bata mo, okay? And then what else? The fetal movement that is, okay, felt here by the examiner, not the woman, but by the examiner, and the delivery of the baby, which of course is self-explanatory. Bata na gulo. Now, mo siya, come to think of it, all those that I mentioned, class, are signs that deal with fetus, class. They are all credited to our fetus, that woman is definitely pregnant. Diba? So, klaro na kaayos na like fetal heart sounds mo. The earliest detection of the fetal heart sound here can be demonstrated at 5 weeks by echocardiography, no? And then an ultrasound also can reveal a beating of fetal heart with the use of the transvaginal ultrasound sound between 6 to 7 weeks. And then the fetal heart sound can also be audible here with the use of the Doppler between 10 to 12 weeks. And with an ordinary stethoscope, class, no, the fetal heartbeat, no, can be heard siya after 16 weeks na to. And to be more exact, that is between 16 to 20 weeks of gestation. And the fetal heart also, the range here, no, of a normal fetal heart varies siya. No, there is a range siya that is 120 to 160 beats per minute. So makita nimo, fetus siya. So klaro na kaayo, di ba? Mados, no? And then ultrasound scanning nimo. Kung sa may makita nimo sa ultrasound scanning, the ultrasound class is actually a technique that can be used here for a positive diagnosis class. Timan na siya ninyo. And that can be considered, this ultrasound can be done here as early as 4th, 5th week no, of the woman's pregnancy through vaginal ultrasound, where the gestational sac can be seen or can be revealed here. Okay? And the third nato is, of course, the unsa man, palpation of the entire fetus na, no? Nga ma-palpate na nimo ang ulo sa bata, ang buko-buko sa bata, ang iyang upper and the lower parts of her body. Okay? So, makita nimo siya, makita, ma-feel na di ay siya, no? By palpation siya, class, no? So, this is a positive sign after the 24th weeks of the woman's pregnancy, if woman is not obese, of course. Okay? So, fetal movements are actively palpable na by our trained examiner, our doctor, okay, at 20th to 24th weeks and onwards, no, of the woman's pregnancy, no? Because at first, in the beginning, yung movement is flattering na siya only the woman, no? May notice it, but this movement siya, kung bata siya, it becomes very vigorous already, no? Lihok na yung kaya siya, no? In the latter part of pregnancy na to, class, no? Or late in pregnancy. That these movements can be palpated already by the examiner class. Okay? So, remember fetus here as our kind of memory aid, no? As we are remembering no, the positive signs, that we are memorizing the positive signs of pregnancy, because we use fetus, the mnemonic fetus, because all of the signs here deal with fetus. Okay? And of course, fetus here is the definite, the conclusive, no, proof of pregnancy. So undeniably, woman here is pregnant, of course, class. So remember lang, no, the mnemonic fetus. F for fetal movement, felt by the doctor. E for electronic device that detects fetal heart sound by Doppler. T for the delivery of the baby. U for the ultrasound that detects the fetus. And S for C, visible movement of the baby by the doctor or nurse. Okay, so those are the signs and symptoms of pregnancy. The first part of our concept, this term, the diagnosis of pregnancy. Okay, so are there any questions? Section G. Naipangutan na?
None so far, Miss.
So prepare tomorrow. Okay, so I will make it tomorrow. So I will give an activity tomorrow before I will start my second concept in our lecture tomorrow. So andam mo, so we will have an activity. No? So we will check again your